to Professor Martin Levermore, who is going to chair the next session. Thank you very much.
Thank you, Fiona. I hope you can hear me.
Yeah.
That's good. Uh, and it's my pleasure to be with you for the next 30, 40 minutes on an important subject. And I think at the beginning of this session, Pablo sort of gave an expression of the need for greater diversity and looking at what we would consider accessing hard to reach communities. For those who can see me, you can see that I'm black, male, aged, and that I'm now middle class and over a certain age. Um, and before I introduce my fellow speakers that will give their presentation, I was asked just to give a personal view of where I've come from. Bit of an imposter as far as health data science as such. Um, in terms that I started my journey as a political economist from those good old days of programming in Fortran and Pascal, and then wind up disposing of bombs and coming back into the world of finance, and eventually winding up in regeneration and finding health, especially within what I would like to term the global majority rather than the minority being less served. It's important in the context as we see this month as being Black History Month, the year being the 75th year of the NHS and 75th year of Windrush, to understand that without appropriate representation in areas that are acutely important to healthcare, that there will always be a barrier of distrust. As such, my work over the last 20 odd years within the healthcare field is about listening and hearing the plights of those that are less served. And it is in the context of being able to understand those on the front line, those that have, over a period of time, felt that their voices and their concerns not being listened to, has brought me into this area of health data science. Predominantly, I've always felt as being the only one in the room. And therefore, the articulation of the global majority was, to a certain extent, lessened in its impact. And we've heard from our previous speakers in the other sessions about bias, unconscious bias in data sets, the inability to gain the trust of certain groups in order to become part of this great community. And the only reason I think we are lacking that confidence and trust is because of personalized representation. But personalized representation, not just because one needs to sit in the room with color, but sit in the room with quality, capability, and experience. The value for me is understanding that actually we are a great big melting pot. And more importantly, to understand the changing world we're living. As I've already described, I'm black, male, middle class, and probably aging. But my next generation is of mixed heritage. My daughter is of mixed heritage. And there's quite a sway that is changing within our global landscape. And unless we touch the zeitgeist of their needs, their confidence, their ability to see themselves in this field, we will always be asking the wrong questions and therefore creating greater and greater bias. So that is a quick sort of spot journey from my perspective. And I have seen with the work with HDR UK, the value sets of the Black Internship Programme, that actually greater representation allows us to think broadly, ask the difficult questions, and to engage a broader group of the populace to be part of this wonderful journey.